Med-educational evaluation of common fall and winter episodic illnesses. As soon as school starts and the weather changes, common symptoms that we see in the medical office are sore throat, runny nose, cough, chest congestion, fever, weakness, vomiting, and body aches. These symptoms may be a sign of serious conditions such as strep throat or flu, or they may represent a simple viral infection. It is important that you see your medical provider if you come down with these symptoms. Rapid strep and flu testing can help to determine whether or not your child or yourself are suffering from flu or strep. Upon physical examination, it is important that the medical provider be able to determine whether or not the patient is suffering from a viral or bacterial infection. This illustration represents the difference between a viral and bacterial case of sore throat. The left side of the illustration represents a bacterial sore throat. Clearly, there are white patches on the tonsils. The tonsils are swollen, and the tonsils are very red. The right side of the illustration represents a viral sore throat. In this case, there are no white patches. The throat may be red, but it should be noted that the tonsils aren't as swollen as compared to the picture on the left. Even though the patient may have the same complaint, the diagnosis is different and the treatment modality will be different as well. A bacterial sore throat requires antibiotic therapy, while a viral sore throat just needs to run its course, as there are no active treatments for viral sore throats. This illustration shows a patient with acute tonsillitis likely caused by strep. Notice the enlarged tonsils. They are approximately 2+, denoting the size, and the right tonsil is touching the uvula. This patient likely has an acute case of strep and would need an aggressive treatment with antibiotics. If the patient has no allergy, penicillin-based drugs would be the drug of choice. An injection of bicillin or ampicillin, followed by a 7 to 10 day course of a penicillin-based antibiotic, would be appropriate for this patient. Another common illness seen in the fall and winter months is influenza or flu. Flu differs greatly from strep throat. Flu usually causes headache, fever, cough, body aches, and oftentimes produces vomiting and diarrhea. The hallmark of flu is that the symptoms set in very quickly. Sometimes fever, body aches, and cough will set in within 1 to 2 hours very suddenly, with the temperature rising from normal to maybe 102 to 103 degrees Fahrenheit within just a few hours. Treatment for flu includes rest, fluids, and medication therapy. Tamiflu is a great medication if taken within the first 48 hours of influenza. Tamiflu can greatly reduce symptoms and help patients to recover more quickly. If you feel like you have flu, it is important that you are tested and treated to prevent the spread of the flu to others. It is also common for medical providers to provide prophylaxis Tamiflu to the entire family of an infected individual.